Hello, my name is Dr. Jared Bergman, and I'm going to talk to you a little bit about scars today and how detrimental they are to your health. Clinically, I deal with scars on a regular basis. We handle scars because of the miscommunication they can cause in the body. So when you have a scar, on the surface of the skin, 80% of our nerve fibers are there. When you cut through that area, you're cutting through those small receptors or nerve tissue receptors in the skin. And what that creates is a roadblock for the nerve flow, which causes our miscommunication. So an example would be the heart, the liver, and you have a scar in the midline area, somewhere in the midline area. The nervous system sends a signal that's supposed to go to your heart, but it actually gets rerouted because it's least resistant and it goes to the liver. After a while, the body perceives this as a confusion. Liver doesn't understand why it's getting this signal that's intended for your heart. This can become a big problem as years go on. Now, what we do to handle scars is actually use a specialized laser that we laser the scar tissue with, and we also use a specific oil that we put on the scar to support the scar tissue itself, and that actually feeds the skin tissue. That actually deactivates the scar. So there is no longer this capacitor type of confusion going on there. A capacitor is something that sucks up all this energy and spits it out at random, and that's basically what a scar is doing. Some of the most common scars we see are episiotomy scars if you've given birth. Those little laparoscopy punctures or scars that can cause a big problem. Any midline scar is definitely a scar to look at. Tattoos have even been a problem. Piercings, belly button, tongue, those areas are definitely affected and very rich with nerves. So you can check out this link that follows this little clip, this little video clip, and that will give you a more in-depth explanation of scar tissue and the science behind it as far as handling the scars themselves.